Hi, I'm Harshad Jeff Tomlinson. Welcome to Yoga as Therapy for the Psoas, sometimes known as the iliopsoas, a deep hip flexor muscle, definitely one I've had issues with over the years. I've had my left hip replaced, and that was a big part of the tension pattern in my left hip. Going into my low back even was, I ran too much, kind of out of neutral, really tightened that hip flexor muscle, a lot of compressive running and then racket sports, etc. And just some genetics caused that tension in the hip. So this yoga therapy practice for the psoas can be really helpful for those recovering from a hip issue or you're dealing with it ongoingly. There's a lot of us that sit too much. Sitting is really a challenge for the psoas because it gets shortened, as I'm doing right now. It's especially if you're sitting for long periods of time and you're working at a desk, or there's stress or tension that you're actually putting into all the muscles of the body, but this one in particular. Then when you try to straighten and lengthen up, you're feeling that tension. You've been to great example, you go to a movie, it's a scary movie, you're sitting in the chair for a long time, or it's just a long movie that's very dramatic, or whatever that might be. And have you ever noticed sometimes you stand up and it feels like, whoa, it's really tight in the body? Well, this is the muscle that can hold that. Driving in a car for extended periods, this muscle group can be affected. So what you're going to see is you're going to see the components of yoga as therapy. So you're going to see a couple of willful positions, one with a block on the floor with the leg swinging, and you're going to see a second one with a tennis ball right in on that spot, part of the iliopsoas, part of the psoas group. And then the third one is a surrender position. So we balance out the willful positions with a deep rest and surrender, where there's nothing happening, where there's slack in the muscle. Very powerful. You're also going to see the final component, which is wonderful, and the influence of our mindful rest yoga nidra practices of visualization, how powerful we now know visualization is in many activities. In this case, we're going to use the visualization of a waterfall. You could use something else too, but I'm going to use a waterfall as an example of this, just the flow of this muscle, just a flow of relaxation and release through that visualization of a waterfall. So I hope that you appreciate this and you can apply this. So maybe 5 minutes total if this is something you're working on a day, and a couple times a day is great. I'm talking about one side, just the right side is my example today, but maybe you need to do both sides. Obviously, you're going to add some more time for that. And over time, what you'll notice is this muscle starts to relax and release. And you might even use your visualization. You can't get on a tennis ball or use the block in the middle of your day, but if you're working with tension in your psoas group, or one side or both, you could use that waterfall visualization that you're using during your practice in your day. You could be at your desk and you can't get up and maybe give a break, but maybe you can do some nice deep breaths and that visualization. So you heard me say breath, and that breath is instrumental in all of this practice. You'll hear me remind you, if your breath gets short and choppy or you're straining, you're moving away from this practice. We're not going to get the benefit. So that long, deep relaxation breath is really key to building even the brain potential of these positions, but also the visualization is enhanced by that breath. So I hope you enjoy it. So this is part one of yoga as therapy for this psoas. We're going to talk about the right psoas muscle. I'm going to stand on a block here. It could be a stair at home, somewhere where you could actually have your hand resting somewhere to secure yourself so that you can stand with, in this case, my left foot is on the block. Okay. My right leg is airborne. It's off the floor. My torso is basically neutral here, my natural curve in my low back. If you know how to stabilize with some core support, those are great tools as well. And then all I'm going to do is swing that leg a little forward and back. Now I'm going to not try to move my pelvis, my belly out and back and forth. I'm keeping myself nice and neutral and simply allow this leg to swing through. It doesn't have to be a big, you're not a track performer, athlete right here. You're just hanging out here, letting that leg swing a little bit back and forth. Breathe. And now we're going to use that visualization process within yoga as therapy as that, almost as if there's a waterfall washing down from the vertebra of your low back down through that inside of the pelvis, down into your inner thigh, down that leg, even splashing out on the floor if you want to see that. Breathe and feel. That full breath is flowing, no strain around the breath. Good. Sometimes I'll even step off and feel the benefit of that. That open psoas on that side. Okay, here's part 2 to address the psoas with yoga as therapy. I have a tennis ball here. And what I'd invite you to do is take the tennis ball and place it right on the inside of this hip bone. So you're going to feel a pointy hip bone right there. It's called the ASIS bone of your pelvis. We're going to move just inside that, and there's a fleshy area right there. You're going to place the tennis ball right there and then roll onto it. Good. If that might be enough for some of you to just breathe and to be with it. If it feels like you need a little extra activity in there, sensation, then you could bend that knee. Some people even lift the body a little bit. And I'm going to invite you to breathe into that spot. And you can even move the tennis ball a little bit more towards the midline. That's moving towards the actual hip socket itself. That might be a little more for me, a little more sensation that I can breathe into. Again, you might just be flat on the floor. Your leg might be lengthened out. In any event, I'd also like you to begin to work with your breath, that full breath, and also that visualization of the waterfall, as if water is spilling from the vertebra of your low back down through the pelvis, down past this sensation you're actually feeling right now, and down inside the leg and all the way down, if you will, to the floor, like a flow of the waterfall. So use that visualization as you breathe and feel. Don't fight it. It's not too much. If you can't breathe, then you're too far. So can you breathe your full breath and stay with this sensation? Good. Okay, we've done those 2 willful positions within yoga as therapy for the psoas release. And now this is surrender. So now we're going to go in the complete opposite direction, if you will, to not do anything in that area. So what I've done is I've taken a chair, and it's nice to have the chair height, the cushion height of the chair about the length of your upper leg. It's called your femur. So that your butt's not off the floor, but it's also not so low that your knees are overly bent. So basically a 90-degree bend at your hips and a 90-degree bend at your knees, give or take. You can bolster that or a blanket if you need to. And then your job is to do nothing, is to set this up. Once it's settled, this is allowing some spaciousness, some slack in the deep hip flexor psoas group that we've been talking about. And here again, in this resting position, you can allow that waterfall flow as if flowing from the vertebra of the low back down through the pelvis, inside of the leg, down, out the foot. Even both sides if you want, a waterfall for both sides of the pelvis. So visualize that waterfall. And again, you can make this a specific amount of time if you're managing your time for A minute to 2 minutes is great with that relaxed deep breath. If you ended up resting here longer, absolutely okay. Especially after a busy day or some strong activity, or just knowing that you need to spend some extra time in resting, can't go wrong with that.